Welcome to the Veterans Impact Show, where our commitment is to help, hope, and healing of our veteran family and our nation. I'm Jim Blythe, a U.S. Navy veteran and a certified senior advisor. Join us as we continue the mission of leadership and commitment to our communities and our great country. Why, you never know where we're going to go or who you're going to meet. We invite you to join in, plug in, and share in what we do. This is your Veterans Impact Show. Well, good day and welcome aboard. I'm Jim Blythe, and thank you to the DBTV network for putting us on Amazon Fire and Roku. We're on Saturdays at 11 o'clock. I got to tell you, they have been really great to us. I also want to thank our sponsors, Fairway Independent Mortgage, who I work for. My MLS number is 311-948-2289 is theirs, and we are equal opportunity lender. Therefore, the attorneys are all happy right now. And on top of that, we have a special new sponsor that's part of our team, Symbios Integrative Health. And joining me today, I've got two beautiful Marines. These ladies are amazing. So today I'm surrounded by Marines, and one of them is the founder. Welcome, Dee Ashmore, Dr. Ashmore.
Thank you, sir. Very nice to be here again.
Dr. Ashmore, you are an amazing Marine. And you're just very quickly, you were an attorney. You were in the JAG Corps. The Marine Corps put you through law school.
Correct.
And then your dad got hurt through a long experience. You got him well with the aid of a specialized machine that you found down in Corpus Christi, with a doctor you'd represented. And then you decided to start a business utilizing this machine, saving lives and health.
I did.
And right now, that you are working towards doing more and more of that with police departments, fire departments, sheriff's departments, as well as the general population. You have specialized in veterans, taking care of a lot of veterans, over 1,000, I understand.
Well, it's closer to 4,000 or 5,000, but yes.
Really? 4,000 to 5,000?
Over all the years, yes.
That's amazing. And in doing that, we're going to get into a little bit later exactly how that works. But your commitment to helping veterans, our people, is amazing. But you're broadening that out and going to be opening other clinics across the nation. Also joining me, Dr. Misty Ely, who is also a United States Marine and a professor and a special counselor. Dr. Ely, welcome aboard.
Thank you. I'm happy to be here.
Dr. Ely, what motivated you to become a Marine? I've always wanted to know that. I know that for Dee, she started from the beginning.
It's pretty funny. People always say, out of all the different branches, why'd you join? And for me, there's a long history of veteran service in my family. So there's 4 generations of veterans before me. All were men and all were in the Army. And then I told my grandfather, who retired as a colonel in the Army Corps of Engineers, that I wanted to join the Marines. And he said, Misty, they don't even have women in the Marines. That's why they're called a few good men. And I was like, no, Grandpa, this is 1997. They do have women now. We're the fewer and the prouder. And he looked at me and said, why? And I said, well, number one, their uniforms are gorgeous. But number 2, when you look at me and you ask me what I do for a living, I want to be able to say I'm a United States Marine. And that was it. I didn't care what my job was. I didn't care what I did. I just wanted to earn the title and serve my country and carry on that family legacy. That was really important to me, to be another veteran that carried down that legacy, because there's not very many veterans there's not very many people that still sign up. It's usually our families that carry on that tradition. And it was important for me to carry on that tradition.
Dee, what motivated you to become a Marine?
Actually, right out of high school, I was going to join the service, and every branch came out to visit me, and I selected the Marine Corps for these wonderful uniforms that we all share.
Okay, guys.
Wouldn't have it any other way. I'm sorry.
I am 3rd generation Navy, and I hated the bell-bottom trousers. I hated that uniform, and I felt like it was, for me, it just felt very uncomfortable. So I went in because I'm 3rd generation Navy, and we all served. I served in Vietnam. You served. You were in the JAG Corps. Misty, what area of the Marine Corps? What was your specialty? What did you do?
I did administration, so I did admin work. It's really funny between me and Dr. Ashmore. She joined the Marines and went in as admin, and they changed her MOS to be legal. I joined the Marine Corps and went in as legal, and they changed my MOS to be admin. So I did admin. I did paperwork the entire time I was in.
All right, we are in the middle of September, which is Suicide Prevention Month. And both of you ladies have had enormous experience with suicide prevention and all. I think the first question that comes to my mind is, what are the predominant causes and what causes suicide? Can you define them? Misty, what do you think?
I don't know if cause is the right word, but there's a lot of risk factors. Specifically, if we talk about veterans, the amount of deployments, but sometimes it's not even if they deploy, that overwhelming sense of wanting to serve your country and then not being allowed to deploy or not having deployed. Maybe you got an injury and you weren't able to serve with the fellows that you trained with. Sometimes that's staggering. Social isolation, loss of other family, loss of service members. But the warning signs are all very different. Performing poorly in school or in work, giving away your possessions, we've seen this a lot, and we can say these are both veteran and civilians as well, making a plan, living recklessly, having no regard of your life, just chasing adrenaline. We see that a lot in the veteran community, that overwhelming sense of, I need to feel that adrenaline rush that I used to feel when I was in combat or when I used to have these dangerous missions and things. And then really the biggest kind of risk factor that I've seen throughout my career working with veterans is lost sense of purpose. You heard me say earlier, I joined the Marines because I wanted to be able to tell people I was a United States Marine. When I left the Marine Corps, it was my choice, but it was because I was a mom and I didn't have a family care plan and no one to take care of my children. So I chose my children over my Marine Corps career and left after 9 years. But there was still this huge sense of loss because all I'd ever wanted to do was be a United States Marine. That's what I was going to do for 20 years. I didn't know anything else. And so even after 3 months of being out, I tried to get back in. Even though I still have my children, I still didn't have a family care plan. I still had to figure out what to do. And for me, it was overwhelming. It took me 6 years to find myself, to find like a sense of belonging, a sense of peace. Every job that I took, I felt like it just didn't measure up to that pride I felt from serving my country, for being a Marine. And really, it was starting back over from scratch. Here I was in the Marine Corps in E6, a staff sergeant in charge of people. And I was important and I was valuable and I was knowledgeable and I was a badass Marine. And here I was as a civilian and I was nothing. And it was very difficult to adjust. And so that is the number one thing I see as working with veterans in the field for so long, is that lost sense of purpose. Nobody knows how to work that faster or to make it easier, that transition for veterans. And each of us have our own things that we have to work through in order to feel like we belong. And a lot of that is our community and coming home. If a veteran comes home to nothing, that's very different than coming home to a family that's welcoming and supporting, to a community that is welcoming and wants them home and wants their stories and wants to learn about their life and welcome them back and collaborate with them, which also leads a lot into peer support. But for me, those are the biggest predictors.
Dr. Ashmore, tell me some of the things that you have seen and what you think about what we're talking about.
Well, everything she said is spot on. And what I would also add to that, once you transition out of the service, everything is so structured and it's just very regimented. You're always told where you're going to go, what you're going to do, where you need to be. There's always something, right? And so many of our people have problems with reintegration. So you lose that sense of purpose, like Misty said, but some of them just feel lost. They don't know what to do. Where am I going to go? Where am I going to live? Where am I going to stay? Whether you have family support or you're on your own completely, there's this loss. And a lot of veterans have explained this to me as excitement. There's no excitement anymore. There's nothing going on. It's just complete unknown. No one's telling you where to go, what to do. You always have a chow hall to go to. Where's my next meal going to come from? You always have a place to live. where am I going to live? What am I going to do? It's basically like starting over. And so many of our fellow veterans start off so early. And, Misty, I'm not sure how old you were. I joined delayed entry at 17. So it's almost like learning all over again. We grow and mature when we're in the service. So when we're kind of just dumped out on our own, what do we do? Especially those with the 20-year careers.
Kind of like a change of persona. Mine was totally different. I was in college, got drafted, decided to go in the Navy, and did 4 years. I was on aircraft carriers, and I met some of the most amazing people. John McCain was one of my pilots, but my pilots were inspirational, and I was hell-bent that I was going to go back to college. I was going to get a degree. And so I can call my dad from Hong Kong. We were there one time, and he said, hey, I've got an appointment. I'm going to go see the registrar down at the University of Texas. And I said, great, whatever it takes, get me in. So when I got out, I got an early out. I went immediately to a junior college in Dallas. I did a semester to kind of get my head back into the academics, get myself reacclimated. And I stayed with my mom and dad. So I had a place to stay. And then I went to the University of Texas. I had an apartment, made a lot of friends, but I was really focused on school. On top of that, I needed a part-time job, and I got a part-time job working as a real estate agent, working as a realtor. By the time I graduated, I had my broker's license in real estate. So I jumped in. I knew where I was going. I was going to get a degree. I think I'm very unusual compared to most. And so that is a cautionary tale right there, that as you get out, if you design that, if you have that plan and you have that structure, and going back to college, getting certifications, you may not want a college degree, but you may want certifications. That worked for me. And it gave me a sense of purpose, and it gave me a career and a start. And I think that was amazing for me. So I hear that because I have hung out, I have been treated at Symbios, and that's like being in group therapy, listening to these guys. And what you're saying is 100% true. I'm beginning to believe that I was very, very different with what I wanted to do. And that made a big difference. Now, I have also had 3 close friends that committed suicide, or at least 2 of them for sure committed suicide. 1 of them, we don't know what happened. But in each case, there was like a countenance change, like a mental change, like all of a sudden they were so visibly depressed. I mean, you'd see them walking down the hallway. One of them I called, and this was after the military, invited he and his wife to come over for dinner. And I was like, oh my God, this guy actually is in terribly, terribly bad shape. I mean, he was terrible shape. And I said, to his wife, God, I know he loves to hunt. Lock up the guns. I can see it coming. And he did that night. I had another friend, Mr. Effervescent, Mr. Happy, automobile dealer. Bing. I get a phone call out of the cold blue. Who knew? But there were visible signs, I think, in all 3 of them. And I'm like, wow, what could I have done? What could I have said? And Misty, you and Dee Dee, you ladies see that all the time because you work with people who are in pain. You work with people, Misty especially, you work with not only suicide prevention, but you were talking about not only the prevention, but the during and the after. I think that's an amazing thing to kind of get into. So let's talk about some suicide prevention, and because when we come back from the break, we're going to take some of the rest of it. So in the prevention, what are some of the things you can see, Misty, to do to help somebody for suicide prevention?
This is really a simple answer and throws most people off, but I will ask the veteran in front of me, what brings you joy? What do you do that makes you happy? And usually that startles them like, do we need to do a safety plan? Like, what else? What are we talking about here? But the number one prevention strategy is to get the veteran to do the things they like to do, the things that bring you happiness, because those things that you do that bring you happiness release those happy chemicals in your brain. Dr. Ashmore can tell you all about the chemicals. But when you do those things that you love, it gives you hope. And that's all you need to get through that day, is a little bit of hope. So I've worked with veterans sitting across from me before when I used to do clinical social work, and I would ask them, what brings you joy? And the veteran across from me would say, my dog. My dog is the only thing that makes me happy. He's happy to see me when I come home from work. He's happy to go to sleep with me at night, and he just showers me with love. I don't know what I would do without him. Okay, then that's what you hold on to right now until there's something else. But right now, if that dog is the only reason you have to live, then that's enough for right now. Having that pet is what gave him joy. For me, it's about finding the things that bring you joy and then implementing more things that bring you joy. What are the things that bring you happiness? So when you're in the throes of depression, it's hard to figure out what makes me happy. We remind our clients, when was the last time you remember being happy? That's a part of what we call solutions-focused therapy, is you remember the last time you were happy, the last time something excited you. So sometimes they'll say, oh, when I used to do art or when I used to golf. And for me, writing was something that brought me a lot of joy. So I write a lot. I do a lot of art. For a lot of veterans, their coping mechanism has always been alcohol or drugs, drinking or alcohol. I know specifically for me in the Marine Corps, that was our number one coping mechanism. In my units was
Welcome to the Navy.
alcohol.
Yeah.
So I had to learn a different way to cope. I had to figure out what were the things that bring me joy and add more of those things to my life. And those became my prevention. Those became, for me, what prevented me from taking my life, and how to teach others to find their own joy in their life every single day, which is way easier said than done. But it starts with one little thing. What is something that brings you joy?
That's such a great thing. I never thought about that. Dee Dee, when we come back, I want to find out what brings you joy, but I also want to find out some of the things that you've seen. Now, we're talking about suicide prevention, and I've got Dr. Dee Dee Ashmore. You're a PhD in neuroscience. Science. Wow, let me tell you, get her started, and you're going to get an education and a half. Misty Ely, I have been to a number of deals. You are also a poet, which is amazing. These are two wonderful people, Marines, U.S. Marines, that carry on the legacy not only of the Marine Corps, but the legacy of service to our nation, service to our brothers and sisters in the Marine Corps. And if anybody ever told you it's not easy being a lady Marine, I'm telling you, it ain't easy. This is Jim Blythe. We're going to be right back. And this is Veterans Impact Show. We're here for you. You connect with us. Welcome back, and thanks to our great sponsors, Fairway Independent Mortgage, Healing Thine Heart's Ministry, and Symbios Integrative Health. Now, let's get back to this conversation. Hey, I got two beautiful Marines, so this ain't no bad deal for an old sailor. But I had to buy a lot of Marines beer way back when to keep from getting beat up, because there was always a Marine and a sailor that wanted to get into it. And I'm like, whoa. But that was one of the biggest problems that I look back on, is so much of the medication was self-medication with alcohol. And we've seen that quite a bit. Dr. Ashmore, Dee Dee, what do you think is the number one thing that is a prevention thing that you see?
Well, as far as prevention, peer support. You've got to have peer support. Everyone needs someone to talk to. Most folks that we see just on the edge begin to self-isolate. There's always, we talk about self-medicating, using drugs and alcohol. So many folks just self-isolate. And that, if they're already in a downward spiral, that's just going to magnify what's going on. So, Misty is wonderful in her job and what she does. She sees so much more in this aspect than I do because of her background and what she specializes in. But peer support has always been, to me, one of the most integral parts of suicide prevention. Everyone needs someone to talk to share. If you can't communicate what's going on. You don't have that warm handoff. As you know, Misty, I think you're the first person. You and Brennan when we would talk over in some of the other programs we've worked with about being the warm handoff, and that is one of the most important things to me, is to be able to have someone to talk to.
That is really, really important. You know, I have tried to talk to people before. Where can you, a Military Peer Network, our friend Ginger Simonson, Lieutenant Colonel Simonson, she's putting together training. Are there other places besides Military Peer Network where you can go to get training if you encounter that? If you're a family member, let's say that I'm a family member and my son's coming home from overseas in deployment, where could I get some training that would give me an idea of how to talk? Because if you don't know and you start seeing all this stuff, you're liable to say the wrong thing or you're liable to freak. So where can we go get some training?
There's a few different things. It just kind of depends on what's in your area. So peer support services, you Google them and you Google your local county. My husband himself is a part of the Military Veteran Peer Network for the Gulf Coast region. So he covers Galveston and Brazoria counties. So for him, if somebody wants information, whether it's a family member, if it's a veteran themselves, or law enforcement, even, they want to learn how to deal with veterans in their own community so they have good interactions with veterans, they reach out to him because that's their local community and they say, can you come teach us? Can you teach us as police officers how to interact better with the veterans in our community? So anybody can ask the Military Veteran Peer Network that's local to their own counties to come in and do either training virtually or in person, and they can give them what we call military informed care training or military cultural competency training. And again, that could be family members. I've had my children come with me before when I've done the training. Part of the program I worked for before with Valor and the North Texas Veterans Court was if you worked with our veterans, you had to go through training in order to understand the veterans that were in our care, to understand their startle response to loud noises, to understand what it was like to be a justice involved veteran. Something that Dr. Ashmore keyed in on earlier that was so important, and I wanted to circle back to that, was as veterans, as service members, we're kind of regimented, which is a harsh word, but it's very true, right? You wake up, you go to your job. If you spend all your money, you still go to the child hall to eat. You got a place to sleep. You got a uniform to wear. Somebody gives you uniforms. So when I used to go throughout the state and teach about veterans, I would say a lot of times I would encounter people that would say, how do veterans end up in jail? How do they end up suicidal? And how do they end up in jail, right? And I'd say, okay, here's a picture on the screen, a veteran in uniform and an inmate. They're both wearing a uniform. They both have to follow rules. They both get a bed to sleep in. They both get meals provided for them. They both get an hour of exercise a day. They get they're away from their family, right? They get an opportunity to go to school. They get their life directed to them. So veterans make really good inmates, and that's a terrible thing. But for some people, they can't adjust back to civilian life, and they end up in the criminal justice system. So sometimes that saves them from the suicidal ideations and thoughts and behaviors. Sometimes it's worse. Sometimes it saves their life because they're no longer using and they're not on the streets. But it was an important point that she brought up, that a lot of times that regimented control need to be able to feel like they don't have to make the decisions, that they end up in the criminal justice system.
Do they feel like that they need that exterior motivation? The motivation I had, and I must have been very different, and I think I am. I'm self-motivated. Man, I'm go-getter. Read motivation books. Love to hear motivation speakers. I'm involved with Symbios as a volunteer. I do my work in the mortgage industry as a certified senior advisor. I do this broadcast, which I love. I've been doing broadcasting since I was 16. I mean, you talk about what do you love? This is what I love, meeting people. I think one of the keys that we just missed is maybe because of that structure, not having the structure, they can't be self-motivated, or they don't self-motivate.
Also, I think, sorry.
No, go ahead.
I was just going to say, I also think statistically, a lot of people join the military because they do not have a supportive life at home. They are joining the military to leave a dysfunctional home. I am one of those people. So I joined the Marine Corps, same thing. 17, signed my life away, left. I graduated high school early and I left and I never went back home. So for me, it was I gained a new family and a new life. And I got away from the trauma, abuse, and neglect by joining the military. And so for a lot of veterans, I'm saying about 80% join the military to get away from a troubled childhood and a troubled life, to get themselves out of that situation where they don't repeat the cycle. So if you get out, especially if you get out and you're not ready to get out, you get an injury or something like that, you know you're going home. If you're going home to a place that didn't support you in childhood, how are they going to support you now?
Yeah, and we got a lot of that. We can talk about that. Let's talk about that when we come back from the break. Again, I want to thank DBTV Network for putting us on Amazon Fire and Roku and smart TVs. Dave Bruner and those guys are terrific. I also want to thank Symbios for all of the things that you guys do to save lives and letting us be a part of your. This is Jim Blythe, and we're here for you. You be here for us. Go to YouTube. Go to Facebook, join us.
Welcome back, and thanks to our great sponsors, Fairway Independent Mortgage, Healing Thine Heart's Ministry, and Symbios Integrative Health. Now, let's get back to this conversation.
You know, one of the things and unfortunately, Cedric White couldn't be with us today. He's Healing Thine Heart Ministries, and he and his wife do marriage counseling, unbelievable marriage counseling for veterans in active duty military. Diane and I went, and it was amazing. I think that one of the toughest things has got to be a marriage in the military. I mean, haven't both of you ladies been married while you were in the military?
I got married just after.
After, and Misty?
I was married. I was married the whole time I was in.
It's terribly difficult, and that extra level of stress that probably gets manifested in some real problems down the road.
Yes. And it's stressful if you have children too. I was explaining to somebody this weekend, we were doing some peer support and having my children while I was on active duty. After you have 6 weeks with your children, and then you have to put them in daycare. That's the maternity timeline when I had my children. So it was like, got to find a daycare, put the baby in daycare because I don't have a choice. I'm an active duty Marine and he's an active duty Marine. And we don't have anybody to take care of our kids at home. So just those little those difficulties of like, okay, we both have duty schedules. We both have work schedules. If one's on night shift, one's on day shift, there's just a lot of things that complicate it when you're both dual active duty.
You know, that's not little, Misty. That is not little. Those are big, big items. And I know what it was like. I had a great wife. She was tremendous, took care of the kids, allowed me to work. I know other people don't get that luxury. So, yeah, that's a real big thing. Okay, we talked about some of the prevention and we talked about some of the signs. What are and one of the things I want to bring up is what you do with Symbios and using the electronic neurotherapy.
Neuromodulation.
Yeah. I mean, this stuff is so far over my head. I've been in real estate all my life. Now we're talking about neuroscience, right? Brain surgery. But one of the things that I have observed by utilizing, and explain real quickly what your machine does in as simple a deal, because it impacts the blood flow and it impacts the brain in a positive way.
Okay, Misty, I'm going to try to take her lead. Whenever we do presentations together, I normally talk, and then she has to come and explain to everybody what I just said. So, in a nutshell, we use neuromodulation, so it's electronic medicine. So, again, my background is neuroscience with a fellowship of electronic medicine, so neuroelectrophysiology. What we want to do is make physiological changes in the brain. Going back to the topic today, so many people suffer some form of addiction instead of just mental health components. And you don't have to suffer any of these on a regular basis. You don't have to be chronically or clinically depressed. But essentially what we do is use electronic medicine at acupuncture points to create a crossbeat frequency and to normalize chemical balance in the brain. So many people, especially military, we always have that fight or flight, ready to go fight, ready to go do something. Too much production of norepinephrine, which is that chemical that just doesn't let your brain shut down at night so you can go to sleep. Too little serotonin. So when we always talk about chemical balances, most doctors just want to give you a pill for this. Let's give you an SSRI. Let's give you an antipsychotic. It's just medicate. What our theory is, let's normalize chemical production in the brain. So if we can use electronic medicine to make your body produce the chemicals it needs to produce naturally, that's exactly what we do. We lower the levels of norepinephrine. We increase the levels of serotonin. We increase the levels of everything that's produced in the hypothalamus to create a balance so you can sleep peacefully at night, get adequate rest, reset the brain. Am I saying this enough to understand, Misty?
Yeah, Misty.
Reset the brain to do what you're designed to do naturally.
Misty,
So-
comment on that.
Explain. So what I tell everybody all the time when we speak together is it's not painful. So when she starts talking
needles.
about electronic modulation and currents, the first thing people think is she's going to shock me. And that's not what it is. So I explain people it's kind of like you ever had a TENS unit attached to you. It's kind of what it is. Or if you've ever had an EKG machine, those little sticky parts from the EKG, they're called leads. They go on your fingers. You do that, and you have 4 of them there, and you do your bottom half, you do your top half after they do the scan. So for me, when I did it, it was amazing because I had been going to the VA for a long time complaining about insomnia. I have really bad triggering PTSD for different stuff, lots of trauma, childhood trauma, and then military trauma. So there were a lot of things that I suffered with, and also a lot of pain in my feet and then in my heart. So I've had a few the VA calls them micro heart attacks. Dr. Ashmore does the neuro scan on me, which looks like this really cool cap with these little, like you belong to Mork and Mindy, little metal things on your head, right? And then it runs all these tests on you. And then she sits down with you and says, okay, the tests show you have neuropathy. And I was like, oh, that explains what's wrong with my feet, like why I'm in constant pain. And then her imaging that they do on you showed I literally had no blood flow in my fingers and toes. So I was in constant pain, and she could tell me why. Finally, after years of trying to get the VA and my own personal doctors to tell me what was going on, she was able to find what was going on. She also found some things going on with my heart. So right away, she was able to say, okay, this is the treatment approach we need for your heart. And I think by doing this, we're going to help you sleep. And by doing this, we can reduce the pain in your feet and in your hands and the swelling. And it took about 48 hours, me doing the treatment 2 days in a row, and I was sleeping 8 hours for the first time in my life in several years. So for me, if we go back to talking about suicide prevention and intervention, you look at a veteran and you say, I can help you with your chronic pain. That is life-changing. We're talking about life-changing, right? To be able to say, I can get up and walk again. This morning I walked my dog 2.5 miles because I'm not in chronic pain like I was before. And that is something that Symbios was able to give back to me, those treatments. It is life-changing. And by taking away the chronic pain and not putting me on medication for the rest of my life was something I didn't even know was possible. And I think for veterans, it's that sense of hope. Give me a little bit of hope. The doctors that we see are often, the first thing they do is psychopharmacology, right? We're going to prescribe you medication that help treat the symptoms of what you're going through. So then the veteran is stuck on this medication forever, right? Because it's just treating the symptoms. They're never getting to the cause of those symptoms. And if you never get to the cause, you're always going to be treating those symptoms. What Symbios does is help to get to the cause, and you still might need treatment. But treatment could be for pain management, like the vector machines. It could be individual therapy, talk therapy. It could be art therapy. It could be equine therapy. It could be writing. It could be journaling. It could be going on vacation every 3 months. Whatever it is that brings you happiness and helps you work through those symptoms, that's what you need to do.
You know, Misty, I got treated. I volunteered. I wanted to get treated. I had a messed up knee that really was bone on bone. I had low functioning kidney from having overdone oxycodone years ago because I didn't know when the doctor said you can take 5 of them. I did, and that didn't do me any favors. It wasn't a VA doctor either. It was another doctor. And then I've had a heart attack in 13 with no damage, but I had a stent. And so I went to Symbios and I started treatment, and I get to sit in the room. And again, it's like therapy, talking to these guys. And I love people, so I'm always talking. And I'm hearing these stories about, man, I was in 2 or 3 IED accidents. I was in an aircraft crash. I was in a Humvee crash. I was in, this or that. I'm going, whoa, man.
Mm-hmm.
Each one of those guys said the same thing. I was suicidal and on so many pain medications, and I thought I was just being pushed off when I was sent to Symbios. And quite frankly, that was the best thing that ever happened. My pain is gone. I sleep through the night. These are not just wild things that I'm saying. These things are amazing because I began to experience that as well. I slept better through the night. My insomnia problems, which I've never really talked about, but it was sleep apnea. That began to straighten out. So I did a angiogram recently from what happened in 2013. My heart had improved dramatically. Now, I exercise a lot. I also had early stages of prostate cancer. That dropped amazingly. I still have it, but it's down to a really manageable level. And my knee, it was creating the fluid. And on top of that, when we got the labs, my kidney function went back to normal. I'm like, wow, this is total body. This is doing it for me. And I'm not even anywhere near what some of these guys have gone through. And then we had a meeting, and I'm talking to a guy who was Hispanic and in English and was Army. And I'm like, wow. And I grew up speaking Spanish. I'm not very good at it. And we chatted for a minute, though, in English and said a few phrases in Spanish. Come to find out, he had dementia so bad that he had lost his ability to speak English, and he was getting very belligerent, which is a typical sign of Alzheimer's and dementia. And the blood flow to the brain brought it back where he was speaking English to me. I'm like, what? This helps dementia, helps heart, helps kidney function, helps pain relief, helps get synaptic. I'm like, how? And I asked Dee Dee, I said, how does it do that? And very, very simply, you said to me, because we can direct these microcurrents, which you can't feel. They're just little sticky pads. It increases blood flow and oxygenation. Wow. Yeah, makes all the difference in the world. So if you get your head right, remember the old Cool Hand Luke story? Get your head right, boss. If you get your head right to where you can think and you can function, then you can begin to get some of these things like Misty you're talking about. The equine therapy, which we have been very active in, other therapy, any kind of positive therapy or talk therapy with a trained clinician like you got a chance to really get it. You got a chance to absorb it, correct?
Absolutely. One thing I'll say is you hit on it is what we do using vector therapy is basically syncing up heart and brains, your heart and your brain's activity. We use the machine autonomously measures heart rate variability. That means what your body's beat frequency is to predetermine the maximum treatment for you. But the most important thing is concurrent polarity, making your body do all the things it's designed to do naturally, where you get blood flow to all of the areas that have stopped for one reason or another. And most importantly, oxygen enrichment at a cellular level. So when we're talking about mental clarity, with dementia, Parkinson's, so many things, getting back to Suicide Prevention Month, are directly or causally related. You might have chronic pain, but that also increases depression and other things. Your body you can't do the things you used to do. You might have a TBI that it's not going to let you create all the normal natural neurochemicals because of the physiological changes manifested in the brain, but that also can create manifestations of chronic pain. So it's one cycle or the other. It works phenomenally well for both. When we first started this technology, we went for chronic pain. We saw what it could do for chronic pain. And then after the years of more clinical research, it was phenomenal in mental health. So, in 2012, we changed up the equipment a little bit to add the dynamics that would, the thermistors that would actually autonomously do diagnostics to better treat the individual than us just playing around with different beat frequency as specialists in electronic medicine. But again, the clinical correlation of the brain and the heart and making your body do all the things it's designed to do naturally is what works so well in getting the patients to sleep. Again, sleep. Your body can only heal while at rest. If you're not sleeping, you're always going to be in that cycle. So if you are depressed or you have suicidal ideation, if you're not sleeping, if you're not resting, if you're not comfortable, if you're not at peace, when can you ever heal? How do you get to someone like Misty to be able to talk about, to communicate? I'm not licensed in any way whatsoever to counsel anyone, just neuroscience. So that's where Misty comes in, and that's especially important for the topic of this month for suicide prevention. Is one, get your brain right, get your body right. We can help with that all day long at Symbios, but we also have wonderful peer support. We have Misty, we have Veterans Healthcare Alliance. Those are the most important aspects.
Let's give out that website because people need to know. And there are other modalities, there are other protocols, but you guys have developed this. You didn't invent the machine, you use it, but you've really developed the protocols to be able. Your book of protocols is about this thick.
I didn't develop those.
Oh,
That's
you
Dr.
didn't?
Rhodes. No. That is Dr. Rhodes.
Well, he's an amazing
all
guy.
Dr. Rhodes, Dr. Donald Rhodes.
Again, let's give out that website.
Okay, for Symbios, it is www.symbios, SYMBIOS, CCN, as in communitycarenetwork.com.
So that's Symbios Integrated Health, or Symbios CCN.com. Jordan, can you bring that up for us? Because I'd appreciate that. And I think this is important because people need to know. Even if you go, well, I'm not interested in that. I'm doctor, I'm doing great. I got to tell you, the more we learn, the more we can earn and the more we can help. Because there may be somebody who needs help and we can figure out a way to get them where they need to be. And hopefully that this will grow. This is FDA approved. There you go. This is FDA approved. And I'm telling you, it works. It's worked on me. I've seen it work on other people. It's truly, truly amazing.
And I will absolutely include, it is not shock therapy in
Yeah.
any respect of the word.
No.
It is absolutely pain-free. If you see on the screen right now, that's one of the treatment rooms. You sit back, you relax in a recliner, you're hooked up to electrodes, 40 minutes on your feet, 40 minutes on your hands, resetting concurrent polarity within your body, and boom.
I got to tell you,
can take a
Dee,
nap.
if you don't get in a conversation with in there, you're going to fall asleep because that's what I did. It relaxes you. It helps. So learn about it. Get to know about what they can do. All right, this is Jim Blythe. And again, I got two great Marines, Dr. Misty Ely, counselor, psychologist, and Dr. Dee Ashmore, neuroscientist. We're here to bring you education, help, and hope. This is Veterans Impact Show. We're here for you. Welcome back, and thanks to our great sponsors, Fairway Independent Mortgage, Healing Thine Heart's Ministry, and Symbios Integrative Health. Now, let's get back to this conversation. I got to tell you, this is a lot of fun because I got treated, and that's why I asked them to come be a part of this program, because we're all about help, we're all about health, and we're all about hope and giving hope. And if you talk to somebody who is recovered from addictions, someone who is recovered from PTSD, someone who is recovered, that's a lot of hope right there. It's kind of like, wow, somebody actually can do this. Yes, somebody can do this, but you've got to do the work. You've got to do the thing. You've got to have the treatments, and it takes time. It's not overnight. It's not something you're going to have happen immediately. And these are not cures, but they sure help a whole lot, and they make a big difference. I want to take a quick story.
We have another Marine that Misty and I both know that has a very impressive SRB. Let's just say he was one of 3 surviving members in his unit after several different tours. And
You got some
guess it
real
was-
nasty fights.
Yes. So last year, I think, I'm not sure when the second of those, but toward the end of the year, the other 2 had taken their lives. So he had some problems coping and dealing, and
He became an alcoholic.
he did. He resorted to alcohol.
I actually had him in my home and trying to talk him down off the ceiling. Then you got him into a facility in Temple, and you taught him how to use the vector machine. You gave him one to take down there.
I did. He went into, so it's a veterans program. We got him into a domiciliary program. And unfortunately, I don't know if they were short-staffed. I don't know what was going on. But really, nothing ever happened in the program. There was no programming in the domiciliary program. And he took one of the vector units, and he went to a different program, and I don't even remember the name of the program. Maybe you do, Misty, but I think he went somewhere out of the country. But he
the
did
bottom
something.
line-
But he took a vector.
bottom
He was doing
line,
treatments.
I saw him 2 months after
Mm-hmm.
you got him taken care of. Never knew anything was wrong with the guy. Smiled, happy, gave me a big hug. I mean, I get hugs from Marines all the time. I'm beginning to worry about you guys a little bit, but
Hey,
I love you.
I've got a really good story.
Okay.
It was he was a Navy veteran, actually, and he was a hugger. That just brought a Navy veteran hugged me. He was a patient of ours and saw Dr. Townsend. We have a medical director. Everyone goes through. I am not a medical doctor. No, I do not have an MD or DO. Everyone has to be medically supervised when they go through the treatment program. So I'm just a scientist. Saw the doctor, was a little discouraged, went through the treatment program, and after he finished vector therapy, he decided to go ahead and try counseling. He was adamant he didn't want to do any of that in the beginning. He did it, went through the program. 3 or 4 months later, he went back to work as a DoD contractor, and I believe he was administering polygraphs for the DoD. And to make a long story short, during COVID, no one could come in over the border. So some of our medical manufacturers, some of our research team had finally come over, and I had a large group of I call our Canadians in my office for a meeting to discuss potential research and new technology in the future. And this gentleman knocks on my door and asks for a few moments. And we're never going to say no to our veterans. That's part of what peer support is all about. So I went to the next room, and this gentleman broke down crying and hugged me. And said that when he came to Symbios, he thought that he was being dumped by the VA because all he was ever just given medicate, sent out to multiple community care providers. And he admitted that he had bought a gun to end his life the day he came to Symbios because he felt like he had just been dumped again.
And he got his life back.
He loved it so much. Yes, he had to come and tell us. Yeah.
All right. I got to tell you, we're going to come up to the end of this program. I got to bring this thing back into the dock. I want to tell you, go to www.veteransimpactshow.com. That's www.veteransimpactshow.com. You're going to be able to see this. We're on YouTube. We're on Facebook. We're also on Amazon Fire and Roku through TBTV Network. This is important that we get you help and healing and hope. We're here to help you. And that's one of the big things about being a veteran is veterans stand together. We've got each other's back. We're doing everything we can to give you a better life. And I don't think you're going to find that necessarily in the civilian world as much as you do in the veteran world. So thank you for being on board. Thank you for being part of what we're doing. And please subscribe to us on YouTube and Facebook. Let us know. You got questions? Let us know. Thank you to Paula. Thank you to Joe. Thank you to a lot of people across this nation that are opening up to us and saying, here's what I'm experiencing. Here's what I need. We're here to help you one way or the other. Now, also, I always like to close with a prayer. So I want to say, Lord God of the universe, you are amazing, and we are thankful, so thankful for all you do for us in putting a hedge of protection around our active duty military, our first responders, those that run into the fire instead of away from it. And dear God, thank you for people like Misty Ely and Dee Dee Ashmore and people who serve above and beyond with a passion to save lives and keep people going. Thank you, God. Thank you, God, for veterans who are trying to bring this nation back together, who are trying to help us to work together. It's important that we bring this nation back together, one nation under God, indivisible, with liberty and justice for all. Amen. Well, this has been Veterans Impact Show. Share this. Learn. See what you can do to not only help a veteran, but help a community member. Remember, veterans lead the way, and Veterans Impact Show leads your way.